In recent months, a viral online movement mixing humor and earnestness suggested that Canada should formally merge with the United States. The campaign drew notice from political analysts, meme creators, and even some US commentators who cited Canada's abundant natural resources and stable governance as an ideal merger candidate. Yet for many Canadians, the proposal sparked more than amusement. It prompted a deeper contemplation of their national identity and the importance of staying distinct from their southern neighbor. While the US political scene grows increasingly divided, turbulent, and crisis-laden, Canada has long valued its moderation, civility, and stronger social safety net. Still beneath this tranquil exterior, a rising crisis reflects America's own grim realities: homelessness. The irony is undeniable. As Canadians celebrate their separation from America's chaos, the streets of Vancouver, Toronto, and Montreal increasingly mirror the very cities they hope to avoid.
My name is Daniela Bavacqua. We've been through a lot. We've been homeless, we've been not homeless, shelters, sexual trauma, a lot of trauma. Drugs, we became introduced by my ex-partner, introduced me to it a couple years ago. I started getting into the down, and it's very hard. I just actually got out of treatment. I did 3 months, and I slipped. So I'm back on the down again, but I will get clean again.
All right, good.
It's a very hard drug to come off of.
Yeah.
Aside is crystal meth. I'm doing that too. I was just locked up in a psych ward for a month and a half because of a psychosis. I was in a psychosis for a month and a half. Never thought I would come out of it, but I did. Thank God. Some people can stay in a permanent psychosis for life, which is scary. But right from the hospital, I went right to treatment, and then I got a treatment, and I'm here, and I slipped. It's hard. It's very hard.
Encampment's addiction, mental illness, and displacement are vividly captured in this ongoing documentary. This is no longer just a Canadian issue. It's part of the same tempest ravaging every corner of North America. Can Canada still be called a safe, stable nation when more people than ever are setting up tents on urban sidewalks? The global perception of Canada is one of tranquil snowscapes, courteous politics, and universal healthcare. For years, Canadians have taken pride in being the calm counterpart to America's turbulent chaos. But in recent times, that polished narrative has begun to fracture, with few issues exposing the cracks more starkly than the rise in homelessness nationwide. In 2023, roughly 235,000 Canadians faced homelessness at some point during the year. That's nearly 1 in 150 individuals. On any given night, over 35,000 people lack stable shelter. These aren't just figures on a government report, they are families sleeping in vehicles in Nova Scotia, seniors huddled on benches in central Vancouver, and youth seeking refuge in 24-hour coffee shops in Calgary. It's a comprehensive humanitarian crisis that for too long has been dismissed as background noise. The COVID-19 pandemic turned a creeping problem into a full-scale emergency. Widespread job losses, soaring rents, and overwhelmed mental health services combined to drive thousands more onto the streets. Emergency measures like eviction moratoriums and federal income support temporarily slowed the decline. But as those safety nets vanished, reality struck hard and Canada was unprepared. What's perhaps most striking is how visibly the crisis has expanded. In cities like Toronto and Ottawa, tent encampments have become semi-permanent fixtures in public parks. In Vancouver's infamous downtown east side sidewalks are often cluttered with makeshift shelters, shopping carts, and the stark presence of untreated addiction and trauma. Even smaller communities like Kelowna and Barrie are now facing scenes that a decade ago seemed unimaginable for towns of their size. So, what shifted? There's no single cause, but one truth is evident. The notion that homelessness is a marginal issue affecting only those with poor choices no longer stands. The current face of Canadian homelessness includes working adults, students, single parents, immigrants, and even employed professionals priced out of housing in overheated markets. This echoes the growing reality of what we've come to know as homeless in America, but it's unfolding here under the maple leaf. Some may still argue that at least we're not as bad as the US, but that reasoning is starting to feel dangerously obsolete. If the benchmark for success is merely lagging a few steps behind a national disaster, what does that reveal about our trajectory? From a personal perspective, as someone who's visited multiple cities, I've been utterly stunned. A decade ago, encampments were rare in downtown Montreal. Now, they're simply part of the cityscape. Canada is navigating choppy political waters, and those ripples are heavily impacting its housing landscape. For example, in early 2025, a US-initiated trade war imposing 25% tariffs on Canadian imports rattled investor confidence, leading to a projected 2% decline in home prices by year's end. While lower interest rates from the Bank of Canada softened the impact, the event exposed how vulnerable Canada's housing market is to its southern neighbors' actions. Concurrently, Canada quietly introduced limits on immigration. From January to April, population growth slowed, significantly increasing by just over 20,000 people. This policy aimed to reduce pressure on rentals, but economists caution that without boosting supply, the imbalance will endure. Indeed, 1/3 of renters already face unaffordable housing and growing fears of eviction. Can curbing population growth truly address a systemic shortage? That's a complex issue, and citizens are still awaiting meaningful government action. Moreover, the April 2025 federal election brought housing and homelessness to the forefront of national debate. All major parties, Liberals, Conservatives, NDP, Greens, promised targeted measures, renter protections, eviction, safeguards, and substantial affordability investments. Yet public confidence is low. Roughly 2/3 of Canadians believe no level of government is doing enough. At times it feels like politicians offer promises of change but deliver mere scraps. Further complicating the landscape, Canada's domestic politics are increasingly divided. Western provinces, like Alberta, are fueling separatist sentiments, partly driven by frustration with federal climate policies and economic oversight. With regional tensions rising, nationwide cooperation on housing reforms remains challenging to achieve, especially when Ottawa's efforts are perceived as favoring certain regions. On the legislative side, Canada pursued ambitious measures. The Affordable Housing and Groceries Act temporarily eliminated GST on new rental projects through 2030, seeking to unlock billions in private investment. Meanwhile, British Columbia's government, led by Premier David Eby, implemented sweeping zoning changes, removing single-family restrictions and encouraging transit-oriented density. However, implementation will take time, and Canada's housing affordability gap remains among the worst in the developed world. What will it take for genuine progress? Will Canada finally achieve meaningful federal-provincial collaboration, or will political division leave hundreds of thousands without shelter? From my experience filming in cities from Ottawa to Edmonton, I can see that communities are more divided than ever. It's no longer just policy papers gathering dust, it's real people sleeping outside, wondering whose promises will finally reach them. When addressing the homelessness crisis, the intertwined issues of mental health and substance use cannot be ignored. In Canada, about 53% of those experiencing homelessness report struggling with mental health issues like anxiety, depression, or trauma-related disorders. Additionally, roughly 45% use substances, often not by choice but as a way to cope with life on the edges. This intricate overlap is widely acknowledged as a dual diagnosis challenge, where both issues fuel each other in a cycle that's hard to escape. In response, Canada has embraced harm reduction strategies differing from the more punitive approaches seen in Homeless in America cases. One highly debated initiative is the Safer Supply program, providing pharmaceutical-grade alternatives to dangerous street drugs like fentanyl. Instead of leaving individuals to face harsh withdrawal or depend on unregulated, often toxic substances, health professionals now offer controlled doses of hydromorphone and similar medications. These are administered under medical oversight, aiming to stabilize individuals and eventually connect them to care. Though controversial, this method has lowered emergency room visits and created more opportunities for broader support, including housing referrals, mental health care, and peer assistance. At the same time, Canada continues to expand its Housing First approach, which emphasizes stable housing as a foundation for recovery. Programs in Ontario and Alberta show that over 70% of participants stay housed after 2 years, with significant improvements in mental health and less pressure on emergency services. By treating addiction as a health issue rather than a crime, Canada is paving a more compassionate and arguably more effective path. It poses a critical question. What does it truly mean to support recovery in a society struggling to shelter its most vulnerable? Education undoubtedly plays a crucial role. Community outreach, peer support systems, and mental health awareness initiatives help reduce the stigma surrounding homelessness. In Calgary, a new mobile mental health unit has provided over 4,000 service visits since its debut in late 2023, directly engaging individuals in shelters and encampments. Canada's federal government has allocated over $200 million in targeted mental health funding for urban areas hit hardest by homelessness, with provinces matching these investments significantly. However, lasting success hinges on coordination. Housing addiction, treatment, mental health care, and job training must work together seamlessly. One study shows that when vocational support is integrated into Housing First programs, employment rates among participants rise by nearly 30% within 1 year. This comprehensive approach not only lowers the likelihood of returning to homelessness, but also strengthens overall community stability. In this section, we've explored how Canada addresses addiction and mental health within its homelessness crisis. Next, we will compare these efforts with responses in New York City, Los Angeles, and Kensington. Vancouver is often seen as Canada's most progressive and compassionate city for social services. Its mild climate access to public funds and harm reduction framework draw those seeking support amid homelessness. Yet this reputation creates a paradox. The more Vancouver invests, the more its streets become overwhelmed by demand. As of early 2025, the city counts over 4,800 unhoused individuals, a figure that has steadily risen over the past 5 years, despite hundreds of millions in new funding. The downtown east side, often viewed as the symbolic heart of Vancouver's homelessness and addiction crisis, now spans multiple blocks crowded with tents, makeshift shelters, and a complex network of social workers, police peer support, and visible poverty. The city has adopted the housing first model and harm reduction strategies, including safe supply programs and supervised consumption sites. But critics argue these approaches lack balance, often prioritizing immediate survival over long-term rehabilitation or reintegration. Others highlight zoning restrictions and delayed construction timelines as major obstacles to expanding affordable housing stock. In many ways, Vancouver reflects Canada's broader challenge, a well-intentioned city entangled in bureaucratic constraints, social resistance, and economic pressures. Turning southward, New York City presents a contrasting yet familiar narrative. With over 8 million residents, the city reported more than 88,000 homeless individuals across its sheltered and unsheltered populations in 2024. Unlike Vancouver, NYC has a legal right to shelter requiring emergency housing access for anyone who seeks it. In theory, this appears humane, but in reality, it has overwhelmed the system, particularly with the recent surge of migrants and asylum seekers. The shelter network has exceeded capacity, forcing the city to convert hotels, gymnasiums, and office spaces into temporary accommodations. Yet New York's crisis feels less visible. Manhattan has fewer encampments than Vancouver, largely due to strict enforcement and relocation tactics. The downside is significant. More people are sheltered overnight, but fewer receive comprehensive long-term services. Like Vancouver, the city grapples with mental health housing shortages and strained services. But public discourse often frames homelessness as a logistical challenge, where to place people rather than how to genuinely support them. Then there's Los Angeles, the most prominent symbol of homeless in America. The crisis here is vast, intricate, and deeply woven into the city's urban landscape. Skid Row remains the most notorious example, with over 3,000 individuals living in this 50-block area, but homelessness permeates every corner of the city. In total, LA County reported over 75,000 unhoused people in its 2024 point-in-time count. Unlike New York, there's no legal right to shelter. Instead, LA relies on outreach teams, temporary housing vouchers, and a patchwork of non-profit-led programs. Results have been inconsistent. The primary challenge in Los Angeles is housing affordability. Median rent in the city surpasses $2,800 per month, while minimum wage jobs rarely provide enough income for even a one-bedroom apartment. Though the city approved billions in housing bonds and statewide initiatives like Proposition HHY, construction timelines remain frustratingly slow. Additionally, Legal disputes over public camping bans have divided local politics, pitting housed residents demanding cleaner streets against advocates pushing for greater compassion. Finally, Kensington, a North Philadelphia neighborhood synonymous with visible public addiction in the United States. Unlike LA or New York Kensington's, Crisis is not citywide, but intensely concentrated. For decades, the area has battled a systemic neglect, poverty, and drug trafficking. Since synthetic opioids like fentanyl emerged, the number of people using drugs in public spaces has surged dramatically. Some areas of Kensington now resemble open-air drug markets with scarce shelter options and underfunded outreach. Kensington stands as a cautionary tale not just about substance use, but about the consequences of ignoring structural decline for too long. While some nonprofits run needle exchanges and community centers, the overall response remains disjointed. There's minimal federal or state involvement compared to larger cities. Unlike the debates in Canada or LA over housing first versus enforcement, Kensington operates in a policy void where no approach prevails and trust between government and community is scarce. Across all four places, Vancouver, New York, Los Angeles, and Kensington, the causes vary, but the human toll is remarkably similar. Lack of affordable housing, unaddressed trauma, economic disparities, and fluctuating political commitment converge in ways that defy simple solutions. So here's the larger question. If cities with billions in funding and decades of experimentation still haven't cracked homelessness, what will it take for any place, Canada included, to get it right? In discussions about homelessness, safety often surfaces as a topic, sometimes with nuance, but frequently with oversimplified assumptions. In Vancouver, like many cities, a debate is growing: does homelessness itself drive rising crime rates? Or is the relationship more intricate? The reality is, most people experiencing homelessness are not committing crimes, but are more likely to be victims. Yet public focus often centers on visible disorder, property damage, open drug use, or tense moments in busy urban spaces. In 2024, Vancouver Police Department noted a 17% rise in disturbance reports linked to homelessness, but closer inspection shows these incidents are mostly non-violent, involving noise complaints or encampment disputes. This prompts a key question. Are we applying the term crime too loosely when what we're seeing are visible signs of poverty and insufficient support? Many neighborhoods near Vancouver's downtown east side have voiced concerns about safety, and those worries are legitimate. Local businesses have called for stricter enforcement, while advocacy groups advocate for increased outreach over crackdowns. The city's approach in recent years has sought to balance both boosting the presence of social workers and health professionals alongside police. Meanwhile, a growing number of pilot programs are exploring entirely different methods. Vancouver has experimented with community-based de-escalation teams operating independently of law enforcement and trained to resolve conflicts without escalating them. Early assessments show encouraging outcomes: fewer arrests, more voluntary treatment referrals, and enhanced public confidence. What if we viewed safety not solely as an enforcement issue, but as a matter of access to services, care, and space? In Vancouver's case, the solution may lie in this shift toward integrated community responses rather than outdated punitive approaches. It's a subtle yet critical distinction, challenging how we perceive public order amid housing insecurity. The homelessness crisis in Canada is no longer a localized problem confined to a few city streets. It is a nationwide issue, reflecting deeper economic, political, and social changes. While comparison to cities grappling with severe crises like those homeless in America may provide context, they should also serve as a caution. What begins with rising rents and unaddressed mental health can spiral into entrenched systemic failure if ignored. Canada still possesses valuable resources, public health care, robust social systems, and a population that largely favors empathetic solutions. But without coordination, urgency, and creativity, these resources may prove inadequate. The true question now is whether Canada will choose to act before the crisis grows too vast to manage. Because ultimately a nation's success is measured not by how it treats its richest citizens, but by how it protects those with the least. The moment to act with clarity and compassion is now.